Hello, my name is Elizabeth Rose Seunarine. You may know me as Betty if we have been together on one of our Medical Ministry International projects. I have been with the ministry for 35 years, over 35 years, and I have been the founder and the coordinator of the area of our service called Integrated Health, Education, and Counseling. I have always been, from the tender age of 14, wanted to complete, as a Christian, as Christ's Great Commission through the field of health and healthcare and medicine. We can liken this journey as to scaling or climbing up a very steep mountain like Mount Everest. Every part of the journey was a step forward. After I lived in the United States, my father was a minister and a theologian, and through that, and my mother a teacher, traveled to quite a few countries. Therefore, there was an international exposure to the importance of networking with our global communities. And as I studied on the path to this goal, I did my Bachelor of Science in Biology at York University, which led me to, after a number of years of working, to contemplating being a doctor, going into pre-med studies, and therefore went another route and went through nursing studies here in Toronto, Ontario, Canada, and worked at Mount Sinai Hospital, downtown Toronto. From that point, another step up the mountain was finding out about nursing school. After being a nurse at Mount Sinai, the International Health Program for nurses, which was being given at Seneca College, had to do with what was really very popular at the time, which was health promotion. Health promotion has to do with teaching and enabling communities to be self-caring with their health. And I was very excited to be able to contemplate going to that train of learning. On March the 8th, 1986, I embarked on my first medical group mission project to practice international health. I was asked to see patients. I had taken a little bit of a crash course in Spanish, and providentially and miraculously was able to see patients, and the rest was history. Since then, the story is quite interesting, quite convoluted, but a lot of open doors, which has led me to several continents. After seeing patients and realizing that more than 75% of what I was seeing was preventable, I was able to include all that I had learned in the International Health Program focused on prevention and develop a whole new area in medical group missions, which would focus on patient education. One of the stories that stuck out, and it has to do with one of the countries I did not know what to expect, was in the continent of Africa. I was in Zambia on my second trip in 2015, April of 2015, and we had planned, together with the local leader from South Africa, Peter Ann Schmidt, we had planned to do training. All primary health care and health teaching has to do with sharing with local leaders the skills of enabling local communities and persons to be aware of their health, early detection, prevention, maintenance of health. And I was going to be teaching a course, a one-day course with the local people from Zambia. There were young people, women, men, teachers, potential nursing students that attended that one-day course. It was just through the hours when we were having the clinic next door, and a schoolhouse was being used for this class. And as we were coming towards the end of that day, I realized there was so much more to share with them included them being able to practice with the patients we had at the clinic. And so I offered the following day to do a half-day sort of wrap-up of the course. And I was surprised, it was unanimous, that they would return for another half-day the following day. The following day came, and we traveled an hour to get to our site at that clinic. And when I walked over to the schoolhouse, they were already there. So it breaks that whole notion of tardiness or slackness as far as people wanting to learn. And later on, what really impressed me was that none of those students lived close to where we were. They lived at least 11 kilometers away, and there was no transport. They had walked 11 kilometers to come and learn about self-care, health, and Christ. That stuck with me because we have preconceived ideas sometimes of people and their habits or their thirst for knowledge, and we could be totally surprised in a pleasant way when we visit these countries. In 2025, our nursing theme is taking care of ourselves, our nurses, our future. And I would say that it is very gratifying. Sometimes in the profession of nursing, we, especially through this time of recent pandemic, we've gotten beaten up. We've felt unappreciated. We've felt that we have been going through burnout, having a lot of demands on our time. And however, when we go into the realm of international health, and particularly in my area, which I have denominated health promotion or integrated health, where as a faith-based ministry, we include our faith, we can return, and we do return the way that we are in Medical Ministry International are set up. We return to these sites time and time again, so that when we do follow up and we do understand that people have caught on to what the tips and the health counseling that we give, and we see change that last. We see people pick up the health counsel that we give them, and we actually see changes. It is very rewarding, very stimulating, and continues to inspire us to carry on our work in building communities and individuals far from our home, but we are leaving a footprint. We are leaving a handprint here on the globe. With MMI, I would say that it's very fulfilling, it's very rewarding, it's very organized. On the field, which I've been on the field for 35 years, I have often been side by side with other members of the volunteers that come on our trips, and they have often made a comment that they had been with other organizations, and this one was very organized, very safe. The opportunities were numerous in which they can use their skills as nurse practitioners, as CRNAs, as nurse anesthetists. Nursing students come and they widen their possibilities as far as their future plans go. And another part of what people appreciate on our teams is the opportunity to serve, and to as nurses, we always want to enable our clients or patients, the people we work with, to better themselves, and we always come out, I would say, more satisfied. And I would say, as a tip, do not be surprised or with the guilt we feel, because we are more blessed in giving than in receiving, actually. And we thought we have gone to help and to serve and to be a blessing, and we have ended up being blessed more than we have been giving a blessing. So you may be wondering, how can I participate on an MMI project? Or at our head office, our program team are experts in plugging you into using your skills in some of the ways that you would want to. It's very seamless, either online or calling our office. We are able to use you, whether, as I said before, as a nurse practitioner, as a nurse anesthetist, as a nursing student. You can bring as a faculty of nursing, as we haven't seen in the past, bring students to do their practicum their skills, their teaching skills in my area of teaching, prevention, community health, public health. We need all of the facets of our great and wonderful nursing profession, and I would reach out to you to please contact us and find out where you may best serve. We have been, as I said, I have had the great opportunity to be in Central America, the Caribbean, in Asia, Africa. We go to the North Past of India. It's a great opportunity to travel, and it's a great opportunity to use your skills as a professional nurse.